Evans from Richmond, Virginia. And I'm Mary Evans from Richmond, Virginia, and I have kind of a twofold comment question thing. First is, I wonder how much more the American taxpayer can take. The TARP, I voted Democrat for over 35 years, but when that TARP bill passed, I know it wasn't under a Republican administration, but it was voted on by both sides, that bill, including President Obama. That passed. Then we have the $757 billion stimulus bill. That's our money. And now they want, and then the bailouts of AIG and banks, and now the health care, all in 8 months. I can't even wrap my head around it, much less, know what's in a 1,000-page bill. Okay, that said, I wonder how much more, that's my first question, we can take. Number two is, I work in an ER. I work specifically with Medicaid patients. I deal with their insurance. I've done it for 9 years. If anyone really wants to know about government intrusion in healthcare, please come and work for a month in my job. 40%, we get ER, I deal specifically with ER accounts. I started figuring out a few years ago, why were people coming in and using the ER for non-emergency situations? Why? They had Medicaid. Why couldn't they go to their doctor? I asked them that. I have no primary care. Yes, you do. Let me see your card. Every Medicaid patient is assigned a primary care doctor. That they couldn't get in to see their doctors. They didn't. They were overloaded. They come into the ER, and 70% of the patients I deal with at my hospital are Medicaid patients. So that's the first. So if the government can't fix Medicaid, which they can't because it's gone on now for 9 years, why should we turn this over to them? I'm sorry, that's the last thing, but that's my 2 questions.
The first question was, how much can the taxpayer stand? In the last 2 years, the number of small businesses that have $1,000 deductibles, high deductibles, went from 20% to 40% in the last 2 years. 20 years ago, the portion of your income that went to health care was about 7%, now it's 17%, and it's going to 24% in the next 10 years. Costs have doubled in the last 10 years, and they're going to double again in the next 10 years. If we don't do something, the question is, how much can the public take? The costs are going through the roof, and if we don't do something, they will continue. There's an old adage that if you don't change directions, you might end up where you're headed. That's where we're headed if we don't do something. In terms of Medicare and Medicaid, there are a lot of areas where there are few physicians, but we have shown that we can keep the cost down with Medicare, and that's the model. Other people with private insurance have trouble just like everybody else. We're trying to do a model. It's not easy. Eric and I agree on 80%. But you can't do the 80% unless you do some of the 20%. We're mandating people to get insurance. We are requiring people, employers, to pay. Now, he pointed out that that's an imposition on employers. That's right. But how are you going to get universal coverage if most of the people get it through their employers? That's a decision we made. There is another possibility. Just do a single payer plan instead of having people run around trying to find their insurance.
I'm not only paying for other people's, I'm not paying for people's private insurance. I'm paying through my tax dollars, I'm paying my own.
On the public option, the people that get the public option card will pay for the public option card. That will not be subsidized by the taxpayer.
All right, thank you.
Hi, my name is Lisa Kent. I'm from Henrico County, and my first question is to Representative Bobby Scott. Since you say that they're going to make up a lot of the money from fraud and waste in Medicare and Medicaid, can we just start that now? Can we start that now? Cut the waste.
Let's not turn this into a revival here. Let the person speak so you don't hear, please.
And let me kind of continue with the lady in front of me, what she had to say. Now, I really do feel bad for the people here that have sick relatives, and I had an aunt that was on Medicare, but she moved
moved from Philadelphia to Virginia and was told, we're not taking any more Medicare patients at this time. So that's what happens. And when you're on the public option, you know, I know that many of you are desperate at this point, and I'm very sorry for that. But you're going to hear that. We're not taking any more public option people right now. It's not going to be a simple fix. And I have to say, as somebody who has watched the last, I'm not a Republican, I'm not a Democrat, the last 8 years, Bush and the Congress, they doubled the national debt, way over $10 trillion, and now we're going to double it again in 5 years. Now, do you really think that this government is going to be able to manage our health care with that type of problem? No. Ask yourself, what is the problem? What is our problem? Healthcare is too high. Yes. And I look at my 53 years, we didn't have MRIs. We couldn't cure cancer. You had cancer, you died. We have the best healthcare system in the world. But we are so fat and we don't get out and get our exercise. That's why people are dying. Yes, some people get rare diseases, and I'm sorry for them. But the government cannot fix it.
Okay, thank you. Appreciate that.
And tort reform would go a long way.
One by one address, and then we'll wait at the end, and then we'll gentlemen from you. Go.
Thank you. Todd Vanderpaul, small businessman in Glen Ellen, Virginia. Thank you, Congressman, for coming out. You've got challenging jobs. My wife and I have been married almost 30 years. We've always had catastrophic coverage. For the last 10 or 15 years, we've had a health savings account. So we have a high deductible. We have 4 children, 13 through 21. We pay $335 a month for that catastrophic coverage. We have over $20,000 in the savings account that's accumulated over time. So I hear numbers thrown around of individuals paying anywhere from $1,300 to $3,000 a month for their insurance. Now, what do they get that I don't get? My coverage may not cover everything, but if you look at those numbers, I save $10,000 to $20,000 a year that I don't pay on insurance coverage. The first thing that needs to be done is remove the deductibility of business, of health insurance from businesses. Give the deductibility to individuals so that they have an incentive to go out and purchase their own, and there's a disincentive for a business, such as Media General, to provide perks through the healthcare system rather than paying wages, because there's tax savings to that. The other thing is, I just see no historical evidence that the government can do this, either in a safe way, provide these services, and certainly there's no evidence that they can do it in a cost-effective way. That's just foolish. The question to both of you, yes or no, if we get a public option, will you swear before God and man that you will put all your faith in that, and that will be your only coverage individually? Yes or no?
Let them think about that for a minute. We'll come back to it.